look at 9, 10, and 12. Alright, so we've done 5, we've done 7 and 8. 9, 10, and 12 go together, they're all here. And 11 is for shoulder shrug and neck. That's so much. Okay, so 9. This one is dry. Okay, let's throw this one.
That's on my jacket now.
Thank you. 9, 10, 12. All right. So if you look in the throat, that is your uvula, and here is your tonsil bed on the side there. And here's your tongue. Okay. So what you do is, if you want 9, is the sensation of the soft palate. So you take a spatula and you compress the tongue at the bottom, and you take another spatula and you say, do you feel there? Do you feel there? Is it the same? Okay? And then you press the tongue down and you say ah. And you check if this moves. If nothing moves, you ask the patient to hyperventilate. And then you can see the soft palate moving more easily. If somebody is weak on this side and he says ah, the strong part will pull it that way. So that will go up on the side and not go up. Okay, or it will pull it to that way. That is the strong side. Okay, that is 9, sensation, and 10. 10 is a very busy cranial nerve, but the way you test it is say ah and hyperventilate. And what you can then do is, you right at the back there, you do the gag reflex. You put the spatula there and you see what happens. If the gag reflex is very high and the patient can swallow normally, if the patient can swallow normally and he's got no complaints and his speech is normal and he can say k, don't do the gag reflex. It's not necessary. Some people are very sensitive to gag. They say, if you put that stick in my mouth, I'm going to vomit. Okay? So if the patient can swallow, you don't need to do the gag reflex. Right. But if somebody struggles to swallow, or they're emotionally incontinent and demented and they're starting to forget, then you must see, is it bulbar or pseudobulbar? If you do that gag reflex and the patient cannot swallow but it's got a very high gag reflex, it's pseudobulbar. And you must think about multi-infarct dementia. Okay. Or operculum syndrome. That's the little lid that covers the insula where the cortex starts. We call it operculum syndrome. If somebody's got. If you have a small stroke there, you won't have a hemi. If you have a small stroke on the other side, suddenly you won't be able to swallow. Okay? Because the cortical supply of the cranial nerves come from both sides, except for the 7th cranial nerve. I'll go back to that now. Alright, and then if you look at the tongue, if you stick out the tongue, you have to see, is it symmetric, straightforward. If one side is weak, it will go to that side. Okay, so the first thing you look is you see if you've got fasciculations or atrophy of the tongue. Is it diffuse or is it on one side? If it's one side, it's the lower motor neuron. If it's diffuse, or the lower motor neuron, remember the cranial nerves are the lower motor neurons of the head. Okay? The upper motor neurons is the cortical supply, cortical bulbar fibers. Right. Just like we have upper motor neuron and lower motor neuron for the body, we've got upper motor neurons, which are the cranial bulbar, and the lower motor neurons, which are the cranial nerves for the head. Right. So if you look at the tongue and you want to look for fasciculations, you must have the tongue inside the mouth. If you stick your tongue out, the tongue will move. Go look in the mirror. If you stick your tongue out, it's going to move. You cannot keep your tongue quiet. So look for fasciculations inside the mouth. Let the tongue relax inside the mouth. Just open the jaw. Look inside the mouth with a nice sharp eye. Tongue fasciculations usually mean that the patient's got motor neuron disease. Right, so that is 9, it's sensation of the soft palate. 10 is the movement of the soft palate. And the gag reflex. Gag reflex is high with pseudobulbar palsy, which goes with emotional incontinence, dementia, and swallowing problems. Lower motor neuron swallowing problems is the bulbar one. They don't have a high gag reflex. Okay? And they are the ones that drool more. So, choose which way you're going to investigate the tongue. If you want to investigate the tongue inside the mouth, weakness is opposite as to when you ask the patient to stick the tongue out. I always ask the patient to stick the tongue out, and then I look to which side the tongue deviates, and that side where it deviates to is the weak side. Right, and then you can take a stick and say push against the stick and push against the stick to the other side. Okay.